Hi, this is E. David Crawford. I'm editor-in-chief of Grand Rounds in Urology. During the last few weeks, we have experienced a lot of challenges in our practice of medicine, and probably more than I've seen in a career in dealing with patients and visits and operations. But out of this challenge, I think there has emerged a lot of ingenuity and focus. And one of the things that is arising stronger, this whole concept of telemedicine, which has been around for a while. Joining me is Dr. Garrett Pohlman. Garrett is editor of a blog called the Prostate Health Blog. This is a very educational thing that just got launched a few weeks ago. Garrett trained at his medical school at the University of Nebraska and was a resident with me at the University of Colorado, and is in practice, in private practice, a small group in Kearney, Nebraska. So Garrett, you have always been on the cutting edge and the educational curve. Tell us what you've learned about telemedicine in the last week, and what you're doing about it.
Certainly. So certainly the implementation of telemedicine can help address the needs of our low acuity urology patient population during the COVID-19 situation. And the CDC has indicated that telemedicine systems should be considered as part of our COVID-19 response system. Historically, the implementation of telemedicine has been met with multiple hurdles, including state and federal regulations, as well as issues with physician reimbursement. But to help broaden access to telemedicine services during this public health emergency, certain federal regulations have been relaxed, including the restrictions on originating site and health shortage area requirements, and payment policies have been expanded. So, this is a situation all of us urologists are dealing with, and just trying to provide care for our patients in this situation. So we've moved on with providing telemedicine service, mostly for our established patients. So the first thing that we did was we checked with our medical malpractice provider, and you really want to make sure that you're covered for telehealth. And then next, what you'll need to do is check with some of the various payers to make sure that telemedicine is covered. And I know this can vary based on different commercial plans in the region you are in. We're starting out with Medicare established telemedicine visits, but we'll be continuing to check with our private payers to see who is covering, and as many as are expected to follow Medicare with this emergency declaration. So there's various platforms available for urologists to easily implement these telemedicine visits quickly into their practice. Some of the more popular ones being utilized include doxy.me, which is a free HIPAA-compliant and easy-to-use telemedicine solution. Many electronic records already have built-in telemedicine capabilities, which is the route our clinic is using. Zoom is another technology some practices are looking at that has a HIPAA-compliant telemedicine option. So our current electronic record has this option, again, implemented within the electronic record, and it is easy to use, similar to doxy.me. It will simply send the link directly to the patient, either via text or email. The patient does not have to download any programs to use it. They just click on the link that we send them. They can either use their smartphone or computer. I think most patients are just using their smartphone if they have this available. But first of all, we also have to look at it from a coding perspective, and I'm certainly no coding expert, but there are various different telehealth codes available. And to keep it simple, our practice is just sticking to established office visits. That's your 99212 through 99214 codes. Now for these codes, Medicare does require the use of live video and audio for the visit. And the main difference is reporting the place of service as a 02 instead of 11, which we use for the place of service for the office.
Uh-huh.
But from a workflow standpoint, it's really not much different than our normal clinic setting. The patient is initially contacted by our medical assistant where medications are reviewed and the review of systems is completed, and that can be done just over the phone. And then I'm using the same follow-up note templates for my electronic record as I normally would. And when I'm connected with the patient on video, I just make sure to obtain verbal consent from the patient to proceed with the telemedicine visit, and make sure to document in the note that this consent was obtained and that this is a telemedicine visit. And you also want to verify that the patient is indeed within the state at the time of the telemedicine visit, as you want to make sure that you're covered there. So I think, there's several resources that have been very helpful during this transition for us. Mark Painter with the PRS Network has been very active in keeping urologists up to speed on the latest coding updates as it pertains to new rules and regarding telemedicine, the AUA. But it's also been very beneficial being part of an active urology community. I'm part of the Thriving Urology Practice Facebook group. It's a group of over 780 members, including urologists, mid-level providers, nurses, and clinic managers. And it's really been a wonderful resource during this crisis in discussing how we are all getting through this and helping each other out.
So Garrett, sounds like you have risen to the challenge as always. What sort of roadblocks are there? You've mentioned 3 or 4. Have you had any challenges with malpractice coverage, with consents, with billing and coding? And then finally, what has been sort of the reception of patients to this, and also your staff?
Well, I think in terms of roadblocks, as far as billing, I think that only time will tell, even though that, things say they're going to be getting reimbursed for it, time will tell in terms of if we run into any roadblocks with that. But I mean, you got to just do what you can do in terms of trying to verify that ahead of time. I think as we get into it, we may run into more issues with sometimes limited internet connectivity in terms of connecting with these patients. I've already heard with some of these different platforms that they've had I think some of these systems are getting overloaded with the number of urologists and just physicians in general logging on to these platforms. And I think they may not have quite the bandwidth to support it. And I've heard of sometimes these systems being delayed or being slowed down. And but as far as from a clinic standpoint, we're just trying to work through this. Our staff has been very receptive to make this happen, and we also have to keep our doors open too in terms of trying to find ways to keep our employees working through this, and but also keep providing care to our patients.
All right, thank you. Is there anything else that you want to share with us?
Well, I think, with this, we might start to even see and start hearing about more home options as well to help collect more information that will help us make clinical decisions. I know you and I have talked about several at-home, such as they have at-home uroflow testing, such as the Stream DX. This is not a system that we've tried yet, but I know several urologists are now actively using this. This is just a home uroflow testing device, which is sent directly to the patient's home. The patient's void into the device multiple times over multiple days, and at the end of the testing period, the patient packages up the bottom electronic puck, so to speak, and mails it back to the company. And then their data is uploaded, a uroflow report's generated, and the physician can then log in to view the data. And some of the existing CPT codes for this include the 51741 for complex uroflow and the 99457 for remote physiologic monitoring. So again, certainly there's limitations to doing telemedicine visit, and this needs to be discussed with the patient when we talk about some of the risks and benefits of doing telemedicine. But again, having additional options like this to help gain more information during this time may help guide our management decisions.
And I can see sending patients to labs to get the lab work done, urinalysis, cultures, everything like that, and then getting that back. Have you implemented any of that as yet?
Not yet. We're just kind of waiting to see. At this point, patients that need their PSA checked, we're still proceeding on with the visit, and then we'll be hopefully getting them set up to just stop by the lab or their remote hospital that's close by to them to go in to get their PSA. But we're not telling them to go in to get their PSA right now. We're delaying that at least several weeks until we know more in terms of when it's better for people to be out and about.
Right. Well, I think this is in a way is sort of a shot in the arm for telemedicine, and a lot of some of the things that we do, follow up patients after surgery and radiation, things like that, basically is a PSA test and how you doing. But we'll see how it goes.
Yeah.
One last question you brought up is interstate use of telemedicine. So if you're on a border state or your patient calls you and he's stuck in California, how do you deal with that? What's the legality of that? Do you know?
That not being a coding or legal expert, I can't, and that may vary from state to state and based on where your licensure is. And so I think probably the best thing to do in that situation is just to check with your medical malpractice as well as your state in terms of the legality of all of that. And I think these are all questions that are going to keep coming up. And I think as we move on, we're going to have more and more clarity over questions like this.
Great. So we're going to your blog that you do is fantastic, and we're going to put this on the website too, and encourage our listeners. I know it's directed more at patients, but I've learned a lot by listening to them. And thanks for doing that, and good luck with that.
Yeah. Well, thank you so much for having me. It's definitely been a pleasure. And with the Prostate Health Podcast, we've had a great kind of reception with the urologists that we've been interviewing. We were interviewing experts in the prostate arena around the globe. And so we're just trying to get, just like this telemedicine, we're trying to, help patients that don't have immediate access to care right now. And much like with the podcast, we're trying to get good information from experts to the general public, but with some of the topics we're covering, I can see a lot of providers listening in as well.
Again, what's the name of it? I called it a blog, but what's the name of it again?
It's called the Prostate Health Podcast, and it can be found, can be listened to directly on the prostatehealthpodcast.com, our website, but you can go to iTunes, pretty much all the major podcast platforms, and it's free, and you can just go ahead and subscribe to the show. And we're coming out with weekly episodes where, again, we're interviewing experts in the field of urology on a weekly basis.
Thanks very much, and have a good day.